So, first speaker of today is Magnus Clarin. Magnus is Dean of School of Information Technology at Halmstad University. And the title of his presentation is Leap for Life, which is a pioneer in healthcare. Leap for Life is a collaborative effort in Halland. It's an information-driven care initiative, and it is an innovation center for Region Halland, Halmstad University, all municipalities in Halland, and the business sector in the joint quest to change and develop the future healthcare. Sounds very, very interesting to me. Magnus has a PhD in physics and is the Dean of the School of Information Technology at Halmstad University, as I said. He has very, very long experience in setting up and running projects between academia, the industry, and the public sector. Come well in handy when you talk about medtech. In 2009, he started the Health Technology Center Haland, which is the predecessor to this Leap for Life. And it's a collaboration arena for healthcare innovations. And the current focus he has is in supporting the development of the transition towards information-driven healthcare, particularly on AI, data factory, and the methods for this. And just to remind you, this is a pre-recorded session, and unfortunately, Magnus will not be able to take any questions after the presentation, so you can send your questions directly to Magnus. His contact information will be in the presentation, so please send them directly to him. So by that, I hand it over to Magnus Clarin.
Hi everyone. First of all, thanks for the opportunity to present Leap for Life here at this conference. My name is Magnus Clarin, and I'm Dean of School of Information Technology at Halmstad University. I'm also chair for the steering group for the LEAP collaboration. And I will start this presentation by showing a short video that introduces LEAP. So hang on. 10 years ago, the collaboration arena Center for Health Technology Halland was created by Halmstad University, Region Halland, and the 6 municipalities, together with the industry. Since then, the world and healthcare has changed. We are now entering a new phase. With Leap for Life, we gather partners to collaborate, drive innovation, and act as the driving force for change within healthcare, both regionally, nationally, and internationally. So what's the challenge? Well, we all need to rethink. Halland is facing large healthcare challenges, so is Sweden and the rest of the world. Health gaps are increasing. Obesity, high blood pressure, and mental illness is becoming more common. Healthcare is subject to antibiotic resistance and pandemics. Since more people live longer because of medical breakthroughs and better welfare, the need for healthcare increases and the cost will increase substantially. So this is just an example. The disease panorama is changing. Fatal diseases is becoming chronic. And this means that it will increase the costs for the healthcare sector. So, large amount of health data are prerequisites for fact-based care delivery. Thanks to technical development, large amount of health data are generated daily, both within healthcare and by other actors. It's everything from information about individual persons' treatments and health in directories and journals to information about health and lifestyle being gathered in apps and sensors. Real-world data from the ecosystem of the world can be used for research, but also addresses important matters like confidentiality, integrity, cybersecurity, and different types of regulatory frameworks. So what's the solution? Well, a big part of the solution is information-driven care. It's fact-based, system-wide, and patient user-centered, supported by leading technology. To manage the challenge the healthcare faces, we need to focus on preventive methods. By using AI and machine learning, we can use data and digital solutions to make intelligent decisions and diagnostics. At the same time, healthcare needs to implement new ways of working, new technologies and new treatments, and it needs to happen now. Similar solution can be used to increase the quality and efficiency in caretaking, new investment in professional development and new welfare technology. Everyday life improves for both care and recipients and caregivers. So this is an image that is fundamental in information-driven care, and we call it the value chain. Data in itself is useless unless you create information that can lead to new knowledge. And that knowledge can be used to create behavioral changes. For example, implementing new ways of working. And that will, in the end, hopefully lead to patient benefits. And then we close the loop, so you need to measure new data and so on. And that's part of the precision medicine and, as I said, a fundamental information-driven care. So this is another image, a very simplified image illustrating the principle of information-driven care. And this system has been implemented in Region Halland together with Halmstad University and Brigham and Women's Hospital in Boston. So why is this happened in Halland? Well, we have the right conditions. Together we have the necessary ecosystem of competences integrated, and that is healthcare development, business development, and research. An analysis carried out by Dunbar Analytics stated that health is a strong field in Halland. There are many strong actors and well-developed collaboration between the business sector, academia, and different parts of the public sector. The productivity within healthcare is 10% higher than the average in the rest of Sweden. And the education level with the healthcare sector is 40% higher than the national average. And at Halmstad University, qualified research is being conducted within, for example, AI and health innovation. And Region Halland delivers a well-executed care and invests a great deal in areas like health, health technology, and welfare. So, within the framework of Leap for Life, Halmstad University's ambition is to become a top performer in research, education, and value creation in information-driven care. We believe that key factors for success is by a multidisciplinary approach in close collaboration within the university, Region Halland, international academics, healthcare providers, and industrial partners. We have many research and collaboration activities that is running right now with many different partners. And I have listed some of them here in this picture. In the public sector, we have collaborations with Region Halland and the 6 municipalities, of course, but also other regions and healthcare organizations in Sweden and in other countries in Europe. In the academic sector, we have collaboration with Swedish and international universities, and in the business sector, we have collaboration with companies within the big pharma, medtech, healthcare providers, and others. And we also have a partnership with AI Sweden here at Lindholmen, and also Swedish Association of Local Authorities and Regions, SKR. Here is a snapshot of what we're doing right now in Halland in the field of information-driven care, using AI and machine learning as a tool. The green ones are projects that has been published already. For example, using AI to predict mortality after ED visits. And this list is growing rapidly, and also the need for high quality data is constantly increasing. To become a pioneer in healthcare, we need to work on several tracks in parallel. We need to have a national spread and acceptance, and that is very important for us in Halland, since we are a very small region. We need to build strong fundamental research. We need to build research together with industry. We need an effective innovation support system, and we need working with competence development and implementation for the professionals, and also building strong international network and increase the commissioned research. Currently, we have activities of different sorts in each of these parallel tracks, together with partners that was listed in some previous slides here. The partnership within LEAP has led to an effective method to evaluate and model the benefits of the new approach in healthcare. So it is possible to form an opinion on the effect of improvement before they are implemented, and to make better decisions about resources, which resources could be used to deliver even safer and more efficient and more future-oriented care. In collaboration with Brigham and Women's Hospital, a data-driven strategic planning was developed, a method and program that allows users to understand the current model and system of healthcare, identify problem areas, and model the impact of potential interventions. And that is in addition to the research project initiated. A new calculation model, patient encounter cost, PEC, was also developed and make the cost calculation more accurate because it takes into account the entire healthcare system, including unused capacity. Example of results from the pilot projects are: fewer suffer a stroke with better support. Specialist support can increase the supply of specialists. Data analysis provide better palliative care, for example. Proactive support reduces short hospital stays, and mobile teams provide faster homecoming. Currently, Halland is now building the infrastructure of data that has been missing in the past. Healthcare, social care, and self-care are linked by the fact that the regions and municipalities are active partners in this work. It attracts some of the world's leading companies and researchers in AI who want to test their solution for more digital care. This will contribute to care and nursing in Halland being characterized by holistic view and being information-driven. So we are currently working in many projects that addresses the future of digital healthcare. The municipalities are investing in elderly apartments with digital technology. Here you should be able to live at home, feel safe and secure, and live a more independent life, and have access to staff if you want to. Safe care remotely and in the home. This is a sort of virtual care system that can monitor different important vital signs in the patient's home. Digga Halland is another example of a collaborative project that will develop the digital competence among employees in the health and care sector. And so far, around 7,000 employees in Halland have taken a web training in the basic of digitalization. So, Leap for Life. Leap for Life is Halland's collaborative effort with information-driven care. It's an innovation center for Region Halland, Halmstad University, all municipalities in Halland, and the business sector in their joint quest to change and develop the future of healthcare. Leap for Life is the new name, and Halmstad University is the host for this collaborative effort. The Innovation Center gathers pioneers from region, municipalities, academia, and business sector, and creates an engine for change. It has a focus on creating infrastructure through the use of, for example, data factory, working with research, supporting professional development, and implementation and commercialization. So finally, our mission is to gather pioneers from the region, municipalities, academia, and business sector, and together we make and enable change and drive the development of future healthcare. We are convinced that there are smarter ways to conduct healthcare and self-care than how it is done today. And we want to make healthcare more information-driven and personalized and make sure both patient and caregivers have a better everyday life. And we believe that the key factor for success is by a multidisciplinary approach in close collaboration between the universities, regions, international academics, healthcare providers, and industrial partners. Thank you very much for the attention.
Thank you, Magnus. And by that, we know all about the public healthcare and the problems they have in Halland. And maybe we can extrapolate that into the society of Sweden as well. But the takeaway here is, of course, that it's all about data. It's about AI. It's about how you manage the data and use the value in that to bring it on. And as I said before, Magnus unfortunately cannot be with us here today. So the questions you have should be sent directly to him. His email address was at the end of the presentation there.